I wanted to talk about the culture in medicine. So in medical school, or the medical school staff at Sheffield, they're very nice and very welcoming, and I feel it's most of the time it's very easy to approach someone. But you do know, if we could maybe contextualize or talk about this, is there is this culture in clinical medicine where seniors are intimidating, very difficult to talk to, maybe you're not friendly towards junior doctors and medical students. It's always intimidating talking to seniors, but why is it the case more so in medicine? I don't know if you agree on that statement, or what ways can we do to change it? Could you talk about that for us?
Yeah, and thank you. I think it's not just exclusive to medicine. Let's put it straight right up front. I think wherever you are, with this business, sports even, when you walk into a team or into a room of full of senior colleagues, there will be some degree of anxiety facing those seniors. Now, how those seniors come across, what's their, how they have developed skills of networking, talking to people, socializing, that does become more important at the time. And junior doctors or junior students or junior players probably won't say much, or they are more on the receiving end in terms of let the seniors speak. And then when the seniors speak, they develop a impression of them, whether it's first impression or a lasting impression. And yes, I think it's across all professions, not just exclusive to medicine, where you can feel a bit daunted when you walk for the first time into an environment where you are not familiar with the people or with the environment itself. Medicine, yes, I think by virtue of who we are as medics, we tend to become very, very organized in our work ethics. That's how we work. There's always patient safety on our mind. There's always a degree of anxiety about our patients. And then to work alongside students or other healthcare staff or professionals, it's not easy at times. So sometimes that also brings out the personalities, or sometimes brings out maybe a few words here and there which might be misinterpreted or perceived wrongly or rightly by some medical students. So what I can say now, after having been on both sides of the divide as a medical student in the previous century and a trainee as well in the previous century or the last one, things have changed, and they have changed for the better. So I think things are much more friendlier. They can be very, very busy, which is another matter. But I think more and more so, colleagues, friends, consultants, junior doctors, they're a lot more engaging. That's the feedback I have picked up. That's what I've heard, seen at times as well. So things have definitely changed. I won't name names or say anything out loud about people, but certainly I've seen both people on extreme ends of being extremely, extremely sociable, welcoming as trainers, and then being very, very strict as well. Now, the strictness could have been misinterpreted as being, something else. So the discipline, as we said, what we might have faced, you may not have seen. We accepted it at the time. It was acceptable, absolutely fine. Maybe in this day and age, things have changed a bit.
Things have changed.